Dr. Bruce Ames. Bruce Ames is a PhD biochemist with the University of California, Berkeley, who has over 540 publications in the field of science on a variety of topics, including cancer, aging, micronutrient deficiencies, DNA damage, and so much more. Among other things, he is famous for his triage theory, which is more commonly known as the Bruce Ames triage theory, which looks at how the aging process is accelerated due to nutrient deficiencies. The theory, in a nutshell, is that the body cares more about survival right now or today than it does 5 to 10 years from now or down the road. So when nutrients are limited and your body has to decide what to do with its limited resources, such as vitamins, proteins, amino acids, it directs them only towards the most essential things needed to survive today. The end result is that your body ages faster and you're more at risk for chronic disease down the road. Looking at things more in depth from a scientific perspective, the Ames triage theory breaks proteins down into two classes: survival proteins required for right now or immediate day-to-day needs, and longevity proteins that work to slow down the aging process and prevent disease. Ideally, the body is building both at the same time, but survival and longevity proteins require many of the same nutrients. In times of suboptimal nutrient intake, the body rations the limited amount, directing them towards survival proteins instead of longevity proteins, which, as previously mentioned, leads to accelerated aging and chronic disease. Some deficiencies within the US population include vitamin D, which is about 70% of us, magnesium, which is about 45% of us, calcium, about 38% of us, vitamin K, about 35% of us. Other ones include vitamin A, vitamin C, zinc, vitamin B6, vitamin E, and folate. So here are a few examples of how this works with the nutrients we just talked about. Let's first talk about calcium. So as we said, about 38% of the population is deficient in calcium. So what does that mean? So because of this deficiency, the body will prioritize the calcium for survival, so for today, which is required for your heart contractions, instead of using it for longevity purposes, such as building those strong bones. So the body cares more about the ability of the heart to beat than the strong bones. Therefore, if you're not getting enough calcium in your diet, your body pulls calcium out of your bones, causing osteoporosis or bone thinning down the road, so it can allow the heart to beat today, which we definitely need right now. Another example is magnesium, where about 45% of the population is deficient. Similar to calcium, magnesium is required for our heart and our muscles to properly contract. And if you are deficient in magnesium, the body will use the magnesium stores for survival to make sure your heart is still pumping, which you definitely want. Magnesium in longevity mode is responsible for DNA repair. Among other functions, low magnesium levels in the long term are associated with premature aging, heart disease, risk of stroke, and increased DNA damage. About 70% of the population is deficient in vitamin D. Vitamin D in survival mode affects day-to-day operations related to blood and calcium levels. Vitamin D long-term is responsible for brain function. Low vitamin D levels are also associated with higher risk of cancer, cardiovascular disease, and all-cause mortality. Vitamin D supplementation has been shown to reduce blood pressure and improve visual memory. Natural sources of vitamin D include the best one, sunshine, and can also be found in lower amounts in fatty fish, eggs, and some mushrooms. About 35% of the population is deficient in vitamin K. Vitamin K for survival today is responsible for blood clotting when you're cut. Vitamin K long-term helps make sure that calcium ends up in the bones versus depositing in soft tissue and arteries. Lower vitamin K is associated with cancer and cardiovascular disease. As it relates to longevity, higher vitamin K levels support longevity by working with vitamin D to build strong bones. Building stronger bones is especially important for individuals as we age, as older individuals are at higher risk for breaking a hip and other bones during a fall. Evolve Wellness's vitamin D3 plus K2 could be an excellent supplement in these cases. Besides vitamins and minerals, other nutrients that appear to follow the Bruce Ames triage theory include antioxidants like carotenoids and other phytonutrients, amino acids like taurine, which protects the organs in your body from inflammation, as well as glycine, which positively impacts connective tissues such as those responsible for the elasticity of your skin, tendons, ligaments, and cartilage throughout the body. As you can see, although you may feel fine today, the lack of nutrition you have now is speeding up the aging process, setting the stage for chronic disease down the road. However, there is always time to make changes, and by starting a healthier life right now, you can reverse these processes and/or prevent them from happening altogether. We can help. Talk to your pharmacist today and let us evolve your health.